Hey guys, Lauren Losing here for my week 38 update from vertical sleeve gastrectomy surgery, which I had on August 21st, 2013 at Massachusetts General Hospital with Dr. Denise G. I just tried making this video before and I didn't have technical difficulties. I'm in such a brain fog today that I think it was possibly the most boring video ever and I was talking about nothing. So if I get stuck, I'm just going to try to cut myself off. There were quite a few things that I know that I have heard lately or seen lately that I wanted to address in a video, but like I said, I'm kind of in a fog and I haven't fully processed what I want to say. So I do these videos on the fly. I don't make notes 99% of the time. I should make notes because I'm sure that I forget a bunch of shit. And that's why I ramble. So anyway, let's just get into the numbers. My high weight, which was also the weight that I was, my first appointment at the weight center was 269 pounds. Day of surgery, I was 245.5. Last week, I was 144, and this week I am 143.5. So that is a 0.5 loss for the week. It is, what, 8.5 pounds from me hitting quote-unquote goal. I say quote-unquote quote way too much and use air quotes way too much. I apologize. You know how, I don't know if anyone else does this, but like watching other people's videos, there are phrases that people always use. Phil says it is what it is a lot. Not that it bothers me, but I feel like that might be my thing. Sorry if it bothers you. So yeah, Phil is 6.2 pounds away. I'm 8.5 pounds away. Like he mentioned, it is a turtle's race to goal right now. I am curious to see if my weight loss will pick back up when I start working out. As you can see, I'm in gym clothes right now. I'm not really feeling very good right now. I'm feeling kind of, and I think I know why. I'm feeling kind of shaky, kind of nauseous, headachy. Don't yell at me. It's 5:40 and I've only had a protein shake mixed with coffee today. I've had 160 calories, which the calorie intake, actually, I mean, obviously that's really low, but, yeah, I was not prepared to be out as long as I was today. Usually I am prepared. I had food on me and stuff, I just didn't want to eat it, which is unusual for lately. But, yeah, I think the coffee, along with, I take a stimulant in the morning, prescribed, not enough water, no other food, I think that's making me feel like this. So, anywho, I'm going to try eating dinner after this and see how I feel about going to my Zumba class. I really don't want to pass out in Zumba. That's not an excuse. I really don't. So if I don't go to Zumba, and even if I do, I think I'm going to go out in my kayak. I've mentioned this before that my parents live on a small lake and we have a couple of kayaks. And it's 70 degrees out right now and sunny. It's beautiful. So I think I'm going to go out in the kayak. But yeah, so I'm wondering that if when I start incorporating exercise back into my life more regularly, if, usually for the first week or so, I have an initial weight loss slowdown, which I can't slow down much more than I am right now, so I might gain a little bit, but I'm curious to see if the weight will start dropping off in bigger chunks like it was before when I start reincorporating that. Because I've definitely lost some muscle. My my arms, I've noticed, have gotten worse, which is going to happen with more fat loss, but I think with the muscle loss, it's also made my skin feel a little looser. So that's going to happen. What else? I never made my Saturday sessions video. I was actually pretty busy this past weekend. Mother's Day was Sunday. Happy Mother's Day to all the mothers and grandmothers and all that stuff out there. And Saturday was another social day for me, and a lot of people lately have been talking about balance and in regards to their personal life and their online, YouTube, Facebook, WLS life. So whereas, you know, for me, that doesn't have to do with being married or having kids. It has to do with, you know, seeing friends and talking to friends outside of YouTube and Facebook, and working and that kind of stuff. So I just didn't end up making a video. I still want to make it. I am working Saturday and Sunday, so I'm going to try to make it over the next couple days. I am going to make notes for that video just because I feel like I have a lot to say and I would probably forget a lot about it, or forget a lot of it. So in the past week, I had lunch with one of my ex-boyfriends, but we've actually been friends. So we met when I was 19 and started dating when I was 19 and till I was 21, on and off. And then we didn't talk for a year after we broke up. But since we started talking again, we've been able to remain friends. So I saw him on Saturday during the day, and the last time I had seen him was probably about, I was almost at my highest weight. I think I probably weighed like 260 pounds when I saw him last. So he's seen me on Facebook and he's seen, you know, my transformation, but when I saw him and he hugged me, and he wasn't saying this in a, you know, mean way, but he was like, oh my God, last time I hugged you, he's like, my hands could like barely meet. He's like, and now I'm hugging you and my arms almost go around you twice. He's like, it's so weird. Crazy. So that was really great to see him. Hung out with some other friends. That was a good time. But yeah, mostly in the past week, it's been work. And at work, I got to see someone speak who, her name is Cheryl Kerrigan, I believe. She is a former patient of the place that I work at, and she wrote a book about her eating disorder and what helped her recover from her eating disorder. So I got to see her speak. That was really good. I mean, to me, she wasn't someone that I connected with, but it was nice because, you know, some of our patients got to see her speak, and there were definitely a couple of patients who did connect with her. But I did make a couple notes about this. A couple of things that she said just kind of resonated with me. So she said that one of her therapists said something to her that was kind of her aha moment, and that was trust in the process. So that's something that I've been saying all along with the weight loss surgery. You know, when the scale, you know, the scale's not moving or the scale's going up, but I know that I'm doing the right thing. I just trust in the process and keep doing what I'm supposed to be doing. And whereas she wasn't talking about the scale, but she was, you know, she had to do what her team wanted to do in order to recover. I'm not saying that I'm in recovery. I mean, I guess I'm in recovery from obesity, but that's not what, I'm not comparing the two of us. I just, I thought that that was really interesting, I guess. Another thing that she said was that she went to her eating disorder not to feel, and that is something that I can relate to, because that's what my eating at night, secret eating, binge eating-ish, has been about. Not that I am going through like a terribly hard time, it's just that that has always been I'm not even going through a hard time. I'm going through a little bit of a stressful time just because it's a little bit of a transition. And since I have my hunger back, eating is how I've been dealing with it. That's how I've always dealt with stress. So I don't let myself feel it. I don't feel the stress, I just automatically start eating. So that's why it's really hard for me to identify, and then it ends up blowing up in my pretty little face. Because then obviously eating isn't actually doing anything about the stress. I'm not facing it head on. And then it gets to a point where I'm like, oh, whoa, where the fuck did all this stress come from? And it's been there all along, and I never addressed it at the beginning stages. So, I found that interesting. Like I said, I'm going to go into eating disorder stuff in a separate video, coming up in the next week. So, next week is my 9-month, I think it's exactly a week from today, is my 9-month surgiversary. So at my 3-month surgiversary, I did a question video. Thank you to all my new subscribers, by the way. I'm at 800 something now, which is awesome. It's so amazing. Thank you so much. I feel like it was just yesterday when I was giving my, doing my giveaway for 269 subscribers. So even though it's pretty far away right now, when I hit 1,000 subscribers, I'm going to be doing another giveaway. I'm not exactly sure what, but I will. Okay, so also for my 9-month surgiversary, I'm going to be doing another questions video. It's okay if they're repeat questions from before. It doesn't necessarily have to be about weight loss or weight loss surgery. You can kind of ask me anything. Yeah. So I'm going to post another little video. I mean, you can leave your comments down there and your questions down there, and I will definitely be keeping an eye on them. I think I'm going to post another separate little, minute-long video saying, hey, I'm going to do a questions video. Leave your questions below. So post them wherever. You can send me messages on Facebook. My name is Lauren Dayton. Anywhere. And I will be doing them probably sometime next week. Maybe Friday morning. So yeah, I think that's it. You guys mentioned, I forgot to mention my haircut in my last video, but you guys mentioned it. So thank you for all the lovely compliments. I cut it off because I was sick of the long, thin ponytail. So, you guys know I don't talk about the hair loss very much, but my hair has stopped coming out so much, like it's so much less now that I've cut it, and this is the first time I've worn it curly since I cut it, and I kind of like it. It's kind of adorable. I'm sure that at some point I will get very frustrated that I don't have long hair, but that's fine. That always happens to me when I cut it. Okay, so I'm at 15 minutes, so I'm gonna go, and wrong side again. Yeah, until next time.